we have all come to expect, challenged, and sometimes even questioned. In the midst of it all, the WHO continued to labor on, offering that beacon of hope in the darkness for so many who lacked the resources and technical know-how to make sense of what was happening, a Florence Nightingale to so many, and for that we say thank you. The organization and its team of professionals not only continued to toil to find answers and make sense of it all, but continued with the other work that it had been tasked, such as Ebola, the Global Action Plan for the Prevention and Control of Non-Communicable Diseases, recommendations to improve diabetes prevention, treatment, and monitoring, to name just a few. Excellencies, ladies and gentlemen, much has transpired since our de minimis session last May and our resumed session in November. We saw the discovery and approval of vaccines to combat the pandemic we all faced. We witnessed healthcare professionals going above and beyond the call of duty to save lives, neighbors helping neighbors, countries displaying a sense of altruism by sharing when some had none or needed a helping hand. While there has been progress, and in some instances very rapidly, I may add, much still remains to be done. We have heard the cry time and time again that too many are being left behind. The Bahamas, my country, has not gone unscathed. As an archipelagic nation, the realisms of outbreaks occurring on multiple islands has been realized. Increasing resources requirements for ensuring delivery of the highest quality of COVID-19 care to all our citizens and residents is an actuality we bear. Our peoples, like those of other nations, have experienced disruptions in well-being through the social and economic challenges brought on by the pandemic. Thankfully, with the availability of the COVID-19 vaccine, access through the COVAX facility and donations, the Bahamas is moving firmly toward having priority groups in the first instance vaccinated. Recognizing that vaccinations signal the beginning of the end of this woeful pandemic, a fully vaccinated population in the shortest period possible is our aim as we seek to regain pre-COVID normalcy across our nation. However, increasing equitable access to vaccines while exposing myths and misinformation fueling vaccine hesitancy is crucial for our collective success in ending this pandemic. But in the process, it is also important that we incorporate lessons learned while we build back better to take advantage of the technologies available to us, and in so doing, ensure that we leave no one behind. The need to remove trade barriers, export measures, and other transit issues that block, restrict, or slow down the supply and movement of vaccines, raw materials, protective equipment, component and supplies needed to ensure equitable distribution globally is most urgent. Excellencies, ladies and gentlemen, The year 2020 is one which will long be in our collective memories as the year when the world was reminded of the undeniable importance of global, regional, and national preparedness for health emergencies, as it is certain that this COVID-19 pandemic has presented an existential threat to us all. Director General Dr. Tedros, the Bahamas is delighted to have had the opportunity to serve as president of this August Assembly during the past year, and we thank you, the Secretariat, and member states for this opportunity. Before we proceed to the election of officers for the 74th Health Assembly, it is my privilege to inform you of the presence of several distinguished high-level guests. We are honored to have them with us, and with further ado, I would like to invite the first of our speakers, the Federal Councillor Alain Bessette, for his remarks. Mr. Bessette, you have the floor, sir.
Chefs d'État et de gouvernement, Excellences, Mesdames et Messieurs. Les avancées sociales et économiques réalisées au cours des dernières années ne doivent pas être réduites à néant par la crise sanitaire actuelle. Et aujourd'hui, malgré les progrès réalisés pour lutter contre la pandémie de Covid-19, nous sommes confrontés à de nouvelles menaces. Elles sont dues bien sûr à la multiplication des variants du virus, mais elles sont aussi liées aux conséquences socio-économiques de cette crise. Et les réactions nationales à une crise globale ne suffisent pas. Elles ne suffisent pas et elles nous démontrent la nécessité, mais aussi les difficultés, en même temps l'évidence de la coopération multilatérale. Et c'est notre responsabilité à toutes et à tous, dans ce cadre, de protéger la santé de toutes et tous, et en protégeant la santé de toutes et tous, eh bien, nous protégeons le fonctionnement de nos sociétés, parce que nous avons bien sûr besoin de sécurité, de stabilité et de prévisibilité. Et nous le savons, au fond de nous le savons bien, ça n'est qu'ensemble et en suivant une approche collective que nous pouvons y arriver. En même temps, en ce 24 mai 2021, nous devons être réalistes. Nous n'y sommes pas encore parvenus et nous devons encore progresser. Et nous devons encore progresser parce que les défis à relever sont nombreux, ces défis sont extrêmement ambitieux. Comment voulons-nous, par exemple, renforcer le multilatéralisme au service de la santé? Quel rôle voulons-nous, dans l'avenir, accorder à l'Organisation mondiale de la santé pour anticiper et pour faire face aux crises sanitaires globales? Mais, mesdames et messieurs, j'aimerais proposer dans ce cadre 3 axes prioritaires pour répondre à ces questions. D'abord, le rôle fondamental du multilatéralisme, ensuite, le renforcement de l'OMS, et enfin, la protection de nos sociétés face à une telle crise. Tout d'abord, le renforcement du multilatéralisme. Nous devons réaffirmer ici, clairement, haut et fort, qu'il n'y a pas d'alternative au multilatéralisme. Et plus d'1 an après le début de la pandémie, nous avons une occasion unique de le faire. La Suisse, vous le savez, s'est engagée dès le début de la crise sanitaire pour une solution, une réponse qui soit globale et qui soit multilatérale, avec plusieurs objectifs, parmi lesquels de garantir un accès rapide, abordable, équitable aux vaccins, mais pas seulement aux vaccins, aussi aux diagnostics, aussi aux thérapies contre le nouveau coronavirus. Et dans ce sens, la Suisse a annoncé il y a peu une contribution supplémentaire à hauteur de 300 millions de francs destinée à l'accélérateur ACTS, et plus d'1 tiers de ce montant doit soutenir le mécanisme COVAX. Nous avons également eu l'occasion, encore ce matin, de soutenir fortement l'initiative BioHub de l'OMS en mettant à disposition un laboratoire de sécurité biologique pour conserver les virus Covid-19 et autres pathogènes. Cette crise nous a aussi montré, mesdames et messieurs, que les collaborations efficaces et innovantes avec le secteur privé sont possibles. Le partage volontaire de licences, par exemple, a permis l'accès et le développement de produits médicaux, tout en respectant les exigences technologiques et de sécurité. Et nous devons aujourd'hui nous appuyer sur ces expériences réalisées dans l'urgence de la crise également, pour développer et étendre ces projets à plus grande échelle. Et ces collaborations innovantes constituent aussi une occasion à saisir pour bâtir un système de protection sanitaire global avec l'Organisation mondiale de la santé en son centre. Nous devons réinstaurer la confiance dans les solutions multilatérales, faire en sorte également que les frontières restent ouvertes pour le commerce et redire ici, nous le savons, aucun pays, nous l'avons vu, la preuve a été faite ces derniers mois, aucun pays n'est en mesure de gérer cette crise sanitaire seul et l'importance de la collaboration multilatérale est aujourd'hui plus évidente que jamais. Cela dit, il ne suffit pas de le dire, il faut encore le réaliser et pour y parvenir, eh bien, il faut une structure claire de gouvernance, une architecture universelle de protection de santé qui sont absolument nécessaires. Et cela justement m'amène à mon deuxième point. Et le deuxième point, le deuxième axe prioritaire, c'est le renforcement de l'Organisation mondiale de la santé. La crise que nous vivons le montre de manière assez évidente. C'est devenu, enfin, ça l'était déjà pour beaucoup, mais enfin aujourd'hui on ne peut plus le contester, c'est une évidence. Nous devons renforcer l'OMS, le mandat normatif, le mandat technique, le mandat opérationnel de l'Organisation mondiale de la santé doit être renforcé. Oui, nous avons besoin, et nous le voyons encore plus évidemment aujourd'hui, nous avons besoin d'une OMS forte, et si nous avons des attentes importantes à l'égard de l'OMS, et si nous voulons qu'elle se montre toujours efficace lors de crises, nous devons, en tant qu'État membre, lui accorder des compétences qui soient suffisantes pour agir et lui accorder un financement qui soit prévisible et qui soit indépendant, en particulier pour le programme d'urgence sanitaire. Dans ce cadre, c'est l'occasion aussi pour moi de vous dire ici que la Suisse soutient l'idée d'un traité sur les pandémies avec comme objectif de renforcer le rôle de l'Organisation mondiale de la santé et d'assurer une meilleure mise en œuvre du règlement sanitaire international. Au cours des dernières années, de nombreux pays, parmi lesquels la Suisse, se sont attelés à mettre en place les mesures requises par le règlement sanitaire international. Et je dois le dire, nous nous sentions préparés à faire face à une épidémie, mais partout dans le monde, nous avons été souvent dépassés par la réalité. Et donc, Excellence, mesdames et messieurs, nous pouvons tous faire mieux. Et nous pouvons faire mieux en renforçant nos systèmes de santé. Nous pouvons faire mieux en appliquant pleinement le règlement sanitaire international. Et nous pouvons faire mieux encore en promouvant l'approche One Health. J'en viens maintenant à mon troisième axe de priorité, la protection de la santé de nos populations et par conséquent la protection du fonctionnement de nos sociétés. Et à cet égard, j'aimerais une nouvelle fois dans ce cadre saluer le travail indispensable et remarquable du personnel soignant, le remercier de son engagement exemplaire. Pour ce qui concerne la lutte collective contre les pandémies, eh bien, la préparation et cette lutte collective contre les pandémies doivent être reconnues, comme par exemple, quand on parle de paix, de sécurité internationale, doivent être reconnues comme un investissement dans la protection des populations et dans la protection de nos modes de vie et la protection de nos sociétés. Cette crise sanitaire touche tout le monde, mais elle frappe encore plus durement les plus vulnérables. C'est bien le problème que l'on rencontre à chaque épidémie ou pandémie, le risque d'accroître fortement les inégalités. Et nous savons que cette crise se décline désormais aussi en une crise humanitaire. Les conséquences sanitaires, les conséquences socio-économiques de la pandémie ont creusé les inégalités, ont attisé les hostilités. Dans ce cadre, évidemment, les attaques persistantes contre les services et le personnel de santé reste une menace sérieuse pour la santé dans les zones de conflit. Et nous le savons, le nombre de personnes ayant besoin d'aide humanitaire va atteindre cette année un niveau record, principalement à cause de la pandémie. Et nous sommes dans ce cadre persuadés que le dialogue sur la santé est fondamental pour trouver un terrain d'entente pour la paix. Il y a bientôt 10 ans que je suis ministre de la Santé pour la Suisse et depuis 10 ans, je suis convaincu que la santé est un enjeu global de première importance, de premier plan. C'est encore confirmé maintenant, malheureusement, au travers de la crise que nous vivons. que nous vivons. Et avec les partenaires de l'initiative mondiale Santé pour la paix, eh bien, la Suisse s'engage à œuvrer en faveur de solutions durables pour faire face aux urgences sanitaires dans les contextes humanitaires. Mesdames et Messieurs, Excellences, évaluer la riposte internationale à la pandémie, tirer les leçons de cette crise, ces thèmes dominent actuellement l'agenda des rencontres au plus haut niveau politique, par exemple lors du dernier Global Health Summit du G20. Cet engagement politique est essentiel pour nous prémunir contre de futures crises sanitaires, car les défis que nous devons relever sont conséquents. Et pour y parvenir, nous sommes plus que jamais appelés à réunir nos forces, à renforcer le multilatéralisme, la solidarité ainsi que la coopération internationale. Dans une Assemblée mondiale de la santé normale, Excellences, Mesdames et Messieurs, c'est maintenant le moment, à la fin de mon discours, où je vous dirai, et je me réjouis de vous retrouver ce soir pour l'accueil de la Suisse autour d'un verre et d'un moment à partager ensemble. Cette année est spéciale, je ne peux malheureusement pas vous y inviter cette fois-ci, mais je me réjouirai beaucoup. Une prochaine occasion, lorsque nous aurons ensemble dépassé cette situation, lorsque nous aurons ensemble vaincu cette pandémie, de pouvoir à nouveau vous inviter au nom de la Suisse pour une rencontre physique. Merci beaucoup de votre attention.
Thank you, Mr. Berset. I'm pleased to now invite the President of France, His Excellency President Emmanuel Macron, to address us.
Chef d'État et de gouvernement, Monsieur le Directeur général de l'Organisation mondiale de la santé, cher Tedros, la pandémie n'est pas vécue, mais nous pouvons déjà en tirer ensemble plusieurs leçons. Et en effet, depuis maintenant plus d'une année, nous sommes toutes et tous mobilisés pleinement dans la gestion quotidienne de cette crise. Mais le temps est venu, et vous nous en offrez l'occasion, à travers cet échange, d'en tirer des enseignements. Le premier enseignement de cette crise, c'est que nous ne pouvons réussir qu'ensemble. Aucun pays seul ne sauvera le monde et aucun pays ne se sauvera d'ailleurs seul. Chacun de nos concitoyens l'a parfaitement compris. Cette pandémie est mondiale par essence. Elle a été par les mécanismes de contamination, elle l'est dans nos réponses. La réponse, elle ne peut donc être que multilatérale, c'est-à-dire la seule réponse internationale coopérative qui permet d'articuler les différents niveaux selon un principe de subsidiarité. Au national, les décisions souveraines et l'organisation des soins, ce qui implique un investissement massif dans tous les systèmes de santé. Au régional, l'action décisive en matière de recherche, d'investissement, de planification. Et nous avons pour cela mis sur pied l'Europe de la santé et nous allons continuer à la renforcer. Et à l'international, la coordination, la surveillance, le partage d'informations, mais aussi la solidarité. Sur ce dernier volet, avec nos partenaires européens, nous avons présenté des propositions concrètes. Premièrement, nous devons nous doter d'institutions à la hauteur de nos ambitions. L'Organisation mondiale de la santé doit être le cœur, la boussole de notre santé globale. Cette organisation doit être à la fois robuste en temps de crise, suffisamment agile pour réagir en urgence, solide face aux polémiques, totalement transparente pour inspirer confiance, avec une gouvernance claire et transparente pour ne subir aucune pression diplomatique et ne pouvoir être soupçonnée d'aucune pression de ce genre. La France soutient donc le renforcement de l'Organisation mondiale de la santé dans son rôle normatif et pour la préparation et la riposte aux futures crises sanitaires. À cet égard, nous devons améliorer le financement de l'Organisation mondiale de la santé pour qu'il soit plus durable, plus prévisible, moins dépendant de quelques grands donateurs. Nous devons aussi étudier les propositions aujourd'hui sur la table pour renforcer sensiblement l'indépendance et l'autorité de l'organisation. Deuxièmement, nous devons travailler collectivement à renforcer la mise en œuvre du règlement sanitaire international. J'ai souhaité pour cela que la France participe à une phase pilote de revue par les pairs des capacités de préparation des États membres aux pandémies. Nous devons aussi donner la possibilité à l'OMS, à travers des missions de réaction rapide, d'être présente sur le terrain dès les premiers signaux d'apparition d'une épidémie. À ce titre, je soutiens la proposition d'attribuer à l'OMS une compétence d'enquête sur les pathogènes potentiellement pandémiques, qui lui donnerait un accès rapide à tous les territoires concernés. La transparence et le partage des données sont absolument clés. Ensuite, la crise sanitaire nous a rappelé que la santé humaine est indissociable de la santé animale et environnementale. C'est la fameuse approche « une seule santé » qui doit guider nos efforts pour être mieux préparés aux prochaines pandémies. Là-dessus, nous avons commencé à avancer, nous l'avons ensemble lancé en novembre dernier à Paris. Nous devons continuer d'élaborer, d'étayer, de concrétiser cette initiative. Enfin, et ce sujet me tient particulièrement à cœur, la pandémie actuelle, avec son cortège de désinformation, nous a permis de constater l'importance de la science et de systèmes de santé robustes. L'accès aux données scientifiques, à une information fiable, la formation du grand public comme des personnels de santé sont essentiels dans le combat actuel contre la pandémie et seront au moins aussi importants face à tous les chocs que nous ne manquons pas de connaître dans les années et décennies à venir. C'est pourquoi, en juin 2019, nous avons initié, avec l'Organisation mondiale de la santé, le projet d'une académie qui serait destinée à former aux enjeux sanitaires globaux les responsables publics, les dirigeants d'entreprises, les forces vives de la société civile mondiale. Car la santé, si elle est fondée sur la science, nous concerne tous. 2 ans plus tard, je suis très heureux d'annoncer avec vous, cher Dr Tedros, que l'Académie mondiale de la santé est lancée. La France s'est engagée à y investir plus de 120 millions d'euros. Elle va devenir la structure de formation de référence au niveau mondial en matière de santé publique. Ses portes ouvriront à Lyon en 2023, mais elle offrira dès cet été un premier catalogue de formation en ligne. La France entend ainsi prendre pleinement part aux négociations à venir sur la réforme de la santé mondiale. Pour avancer très rapidement dès cette Assemblée, l'adoption de la résolution portée par l'Union européenne sur le renforcement de l'action de l'OMS dans les situations d'urgence sanitaire serait un premier signal fort. De même, je vous engage à valider le lancement des négociations sur le traité international sur les pandémies. Nous avançons, nous le devons. Voilà les quelques mots, quelques convictions que je voulais partager avec vous, chers Tedros, chers tous. Soyez assurés en tout cas du plein engagement de la France, aujourd'hui comme demain. Merci.
Thank you, Excellency. I shall now invite, with pleasure, the Chancellor of the Federal Republic of Germany, Angela Merkel. Your Excellency, you have the floor.
Sehr geehrter Herr Generalsekretär, verehrte Damen und Herren! Seit mehr als einem Jahr leben wir mit und kämpfen wir gegen die Pandemie. Wir haben Fortschritte gemacht, aber auch Rückschläge erlitten. Es ist deshalb auch an der Zeit, Lehren aus unseren Erfahrungen zu ziehen. Denn eines ist klar, diese Pandemie ist noch nicht bewältigt und sie wird auch nicht die letzte sein. Auch in Zukunft wird es immer wieder zum Ausbruch neuartiger Krankheiten kommen. Daher gilt es, die Welt in die Lage zu versetzen, auf pandemische Bedrohungen möglichst rasch reagieren zu können. Hierfür haben die WHO-Arbeitsgruppen zur Evaluierung der Covid-19-Reaktion klare Worte gefunden und konkrete Vorschläge gemacht. Besonders hervorheben möchte ich die Idee eines globalen Gesundheitsrates. Dieser könnte die Einhaltung der Gesundheitsvorschriften in den Mitgliedstaaten überprüfen und damit sowohl Prävention als auch Reaktion verbessern helfen. In ihren Berichten begrüßen die Arbeitsgruppen den globalen Pandemievertrag als wichtigen Baustein im Reformprozess der WHO. Ich teile diese Auffassung. Wir sollten diese Vorschläge aufgreifen, gemeinsame Regeln erarbeiten und für deren Einhaltung Sorge tragen. Damit wäre sowohl der Vorsorge jeder einzelnen Nation gedient, als auch der gemeinsamen Alarm- und Reaktionsfähigkeit. Die Pandemie führt uns besonders vor Augen, wie wichtig internationale Zusammenarbeit ist. Die WHO sollte deshalb weiter eine Führungsrolle bei der globalen Gesundheitsvorsorge übernehmen. Dafür müssen wir die WHO aber auch finanziell und personell nachhaltig unterstützen. Darüber diskutieren wir bereits seit Jahren. Nun gilt es aber umso mehr, endlich zu handeln. Das sollte uns unser aller Gesundheit wert sein. Daher möchte ich alle einladen, die noch nicht dabei sind oder noch zögern, die Idee eines globalen Pandemievertrags zu unterstützen. Nach der Pandemie ist vor der Pandemie. Auf die nächste sollten wir möglichst gut vorbereitet sein. Das ist das Signal, das ich mir von dieser Weltgesundheitsversammlung erhoffe. In diesem Sinne wünsche ich viel Erfolg, den wir alle weltweit dringend brauchen. Vielen Dank.
Thank you, Excellency. I have the honor to invite the President of the Republic of South Africa, His Excellency President Matamela Ramaphosa.
President of the World Health Assembly, Director General of the World Health Organization, Your Excellencies, Heads of State and Government, members of the World Health Assembly, and esteemed colleagues. This assembly is taking place in one of the most critical periods in recent history for the world. Every country is affected by this pandemic. Millions of lives have been lost. Every sphere of life has been disrupted. And citizens of every country have had to endure severe hardships. And this pandemic has made us more aware of our strengths and our vulnerabilities. It has also demonstrated how interconnected we are and how dependent we are on each other for our health as well as our well-being. At this year's World Health Assembly, we are urged to end this pandemic, prevent the next one, and build a healthier, safer, and fairer world. This has to be our agenda. This requires that we attend with some urgency and purpose to the huge divide in the provision of COVID-19 vaccines to the peoples of the world. Millions of people in wealthier nations have been vaccinated, while billions of people in poorer countries still wait and are still vulnerable to infection, to disease, and to death. We all need to work together to correct this situation. This is not only a moral imperative. Effective and comprehensive global vaccination is vital to ending the pandemic. None of us can hope to be safe unless we are all safe all over the world. I've been honored to co-chair the Access to COVID-19 Tools Accelerator with Prime Minister Solberg of Norway. We sincerely thank funding partners and the scientific community for working so rapidly to develop vaccines, diagnostics, therapeutics, and other essential needs. We call on all leaders to continue to support this essential initiative so that we can raise the $18.5 billion that is needed to ensure that appropriate tools for prevention, diagnosis, and treatment reach all parts of the globe. We must urgently increase vaccine production across the world, including in low and medium income countries. Among other things, we need all countries to support the call for a limited waiver on intellectual property rights as a mechanism to promote rapid, equitable access. This will allow countries to allow the use of intellectual property, to share technologies to produce vaccines and therapeutics, to lower prices and expedite distribution to everyone, everywhere. As we emerge from the worst of the pandemic, we need to build more robust pandemic response systems. We need to give attention to the establishment of a global health council that collaborates with the WHO to support regional and national response mechanisms. We need to invest in our national health systems, understanding that these are vital to the health of our people and the sustainability of our economies. While the pandemic has exposed some of the weaknesses in our respective health systems, it has also required decisive measures to strengthen them. In our case, for example, we have had to respond to the fragmentation of our health system, integrating services between the public and private sector, and improving coordination between the different spheres of government. We improved our capacity to do genomic analysis, relied more on scientific evidence to manage the pandemic, and improved diagnostics and increased oxygen supplies. We need to unpack the global lessons of COVID-19 as we plan for the future. Building healthier, safer, and fairer lives is also about delivering integrated services for HIV, tuberculosis, non-communicable diseases, and maternal, newborn, and child services. We cannot reflect on this moment without recognizing the contribution of the millions of health workers and other frontline personnel around the world who have really demonstrated amazing courage and dedication. As a global community, we are grateful to Dr. Tedros Ghebreyesus for his leadership and the World Health Organization for its dedication, its hard work, and tireless efforts. As humanity, we are in the midst of a devastating crisis. Let this be a turning point in our attitude towards human health and well-being. We should make this the beginning of a journey towards a fairer and safer world. Let us also deepen global solidarity and cooperation, and let us face the future together. And Dr. Ghebreyesus, I thank you and your entire staff across the world for an excellent job that has been done in managing this pandemic. May you go from strength to strength together with all those that you work with. I thank you.
Thank you, Excellency. I have the honor to invite the President of Estonia, Her Excellency President Kurs Kajitieit. Excellency, you have the floor.
Dear President of the World Health Assembly, Director General of the World Health Organization, Excellencies, dear delegates. We have been through a very difficult period in our world, but I hope that finally we have learned that even those in this world, best off, who feel like they are insulated from all the problems because they have the resources, they have access to resources, that they are not, in fact, isolated. And this is good. This is the silver lining of this cloud. We now realize, for example, that all population of this world needs to be vaccinated in order for everybody to be safe in this world. This virus, SARS-CoV-2, this has taught us that we need to think of everybody, of the billions on this world. And unless we make sure that everybody has access to safe vaccination soon, virus will be back, and it might be even more difficult to fight it. Mutations are created everywhere, not only among those who are rich and best off and can vaccinate, but also in the bodies of those who are still waiting. Estonia is part of the COVAX vaccination system, and we wish all the best to World Health Organization to maintain their good work at vaccinating everybody. But we must also understand that vaccination for all other diseases has stalled in the last year. Children, hundreds of millions of children, have missed school meals. And then there are wars, other problems of our world, which will be enhanced by the bad developments in the climate change process. The wars mean that children, women, adolescents suffer most. For example, in Afghanistan, out of 34,000 midwives, only 6,000 can work and help women because there is war. World Health Organization has worked hard and is continuing to push for better developments. And we believe that new technologies help them to work even better for everybody on this world. Estonia has been part of the World Health Organization's push for global vaccination certificate development, which will help us to return to traveling globally. But this is not enough. Many countries cannot participate because they do not have digital e-health systems. I hope, that's my dream, that in 5 years' time, every country in this world will have at least digital population registry, where every mother can register the birth of every child from the mobile phone or other tools accessible for them without going anywhere. And you know why this is very important? This way, technology will make vaccination, nutrition help, universal health care, if one day we are willing to provide them to each and everybody on this world, accessible. Because at least, and this is really the lowest common denominator, at least we would know who was born to whom and where. This is how we in Estonia see how technology can come to help to resolve the global health problems. Yes, it will not resolve everything, but at least we will know exactly where and how big our problems are. In Estonia, we have created a universal healthcare model. We have created a system where children are fed at school. And we have also created digital ecosystem to make sure that nobody misses out. I really wish this for all of the world, for all children, women and adolescents of this world. Thank you for listening.
Thank you, Excellency. I shall now invite with pleasure the Prime Minister of Antigua and Barbuda, His Excellency, the Honorable Gaston Brown.
Mr. President, Director General, heads of government, heads of delegation, distinguished ladies and gentlemen, I am honored by the invitation to address this formal opening of the 74th World Health Assembly. Of all the assemblies this organization has held, none has been more vitally important than this one. It is no exaggeration to say boldly that the future or fate of all mankind depends on the decisions that this assembly will make. The world is ravaged by the COVID-19 pandemic. Not only has the coronavirus infected almost 166 million persons worldwide, it has also officially killed more than 3.5 million people globally. Worryingly, recent estimates suggest that because of underreporting, actual deaths might be as high as 8 million persons. Mr. President, that startling figure should caution every person in the world to understand that to refuse vaccines is to court death. We are fighting a war with a grim, pernicious, and pervasive reaper of death and destruction. No nation has escaped it. No nation is immune from it, and no nation can isolate itself from it. If ever there was an irrefutable truth to the affirmation, we are all in this together, that truth now stares us directly in our faces. Mr. President, realistically, the global community is in the midst of two catastrophic events. The first and preeminent tragedy is the distressful deaths of millions of people, and the second is the ruination of economies globally. Some wealthy nations may survive these two afflictions, but the majority will not. In any event, no country, however rich, will escape the consequences unscathed. Unless this assembly agrees to comprehensive and decisive action and commits to an urgent and binding implementation plan, our one world will be injured irreparably with profound repercussions for all. Therefore, I urge that this meeting approach this matter as one that is of common urgency affecting all humanity and threatening the well-being of all. In this connection, we are all aware that a few of the world's richest nations had contracted to purchase exclusively more than 50% of the 4 vaccine types that had been produced up to May 7th, when the WHO listed China's Sinopharm COVID-19 vaccine for emergency use. This situation has led to a flood of vaccines in a few wealthy countries and a drought in the majority poorer nations. It should distress us all that of the 1.6 billion vaccines already administered globally, over 50% have gone to wealthy countries, while low-income countries and vulnerable states have received minuscule amounts. Global economies will not recover if some nations are fully inoculated and others are left deprived. Vaccine equity is critical to achieving global herd immunity and to contain the emergence of more deadly and debilitating COVID-19 variants. No person of conscience should be comfortable witnessing the awful television images of the bodies of COVID-19 victims floating in rivers, or the mass burning of their corpses, or hundreds of people being thrown anonymously into mass graves. The leaders of our one planet are summoned to serve a higher purpose, the worthy cause of saving lives. In this regard, this ignoble system of vaccine apartheid must end, and end now. Nations that have stockpiled more vaccines than they require must release them to those who need them. We are thankful to the government of the United States of America for its recent announcement that it will share 80 million doses of vaccines with other countries. We call on other governments that have either stockpiled vaccines or locked them up in contracts with suppliers to join the United States in releasing their surplus through a global plan managed by this World Health Organization. Supplying vaccines to save lives should also not be a matter of bargaining or of leveraging political support. It is the honorable and right thing to do. Apart from releasing surplus vaccines, the governments that now maintain intellectual property rights that prohibit wider and greater production of vaccines must act now to waive them. More pharmaceutical companies producing much more vaccines will mean more and fast inoculations of our global community. That is not only in the interests of the countries where COVID-19 is rampant. It is in the interests of our interconnected world, where every nation is dependent on the interaction of people across borders and on healthy markets with purchasing power. It is especially troubling to many small states, including mine, that because our capacity is wrongly measured by our relatively high per capita income, we are denied access to supply of critical life-saving vaccines under the COVAX facility unless we pay. Small island states such as mine, which are perennially vulnerable to hurricanes and exogenous shocks that are no fault of our own, such as COVID-19, have to find the money to purchase vaccines and to do so at high cost. We have had to do so even while the pandemic has caused a loss of 30% of GDP and halved our revenues. Our countries are teetering on the brink of economic disaster. In this context, we make an appeal to relax travel restrictions for vulnerable small states and rectification of the qualifications for access to the COVAX facility so that account is taken of the profound vulnerabilities of small island states. Vulnerability should be one of the determinants for vaccine accessibility. Finally, I draw attention to the phenomenon of vaccine reticence in all of our countries. This is no longer a matter for individual countries. It has become a pandemic as dangerous as COVID-19 itself and will cause millions more of our people to be infected and all our economies to decline. Vaccine reticence now needs a global response that is no less comprehensive and intense than the response to the pandemic itself. We have to collectively educate our peoples of the value and benefits of inoculation to themselves, to their loved ones, the wider society, and the global community as a whole. Mr. President, our world is in a global crisis. This Assembly must act now to imbue all our societies with the confidence that we, the governments, are acting in solidarity to take back our world from the stranglehold of this pandemic and to set our peoples free. I thank you.
Thank you, Excellency. I have the honor now to invite the Prime Minister of Spain, His Excellency Pedro Sánchez Pérez Castellón, to address us.
Señoras, señores, comienza hoy la Asamblea General de la Organización Mundial de la Salud, una reunión trascendental para el futuro del sistema global de salud. La pandemia, como sabemos, no ha terminado. Aunque hay algunos países que están viendo la luz, debemos seguir haciéndole frente con convicción y para ello la prioridad es garantizar el acceso universal a las vacunas. Por eso desde el Gobierno de España hemos lanzado la iniciativa multilateral Vacunas para Todos, que aborda el desafío mundial de producción y también de distribución de vacunas en toda su complejidad. Con esta iniciativa proponemos actuar de manera simultánea en 3 frentes que frenan ahora mismo el acceso equitativo a las vacunas. En primer lugar, debemos compartir conocimiento de todo tipo, incluyendo la transferencia de know-how, de tecnología, así como también los aspectos relacionados con la propiedad intelectual. Con tal fin, España se ha unido formalmente a la iniciativa CITAP, COVID-19 Technology Access Pool, como herramienta para facilitar estos intercambios de conocimiento. Invitamos al resto de gobiernos y muy especialmente a la industria farmacéutica a que se sumen para que esta iniciativa pueda lograr resultados tangibles. Sin duda alguna, los derechos de propiedad intelectual deben ser parte de la solución, pero también debemos avanzar rápidamente en otras áreas. Y por eso, en segundo lugar, debemos tomar todas las medidas posibles que nos permitan aumentar la producción de manera exponencial y además en un muy corto espacio de tiempo. Para ello, debemos ser capaces de identificar las capacidades globales de producción, ayudar a ajustar la oferta, también la demanda en este ámbito. Y además, con el apoyo activo de la Organización Mundial del Comercio, se deben eliminar todas las barreras comerciales a lo largo de la cadena de valor, una cadena que abarca no solamente las vacunas, sino también los componentes necesarios para producir esas vacunas. Y en tercer lugar, tenemos que facilitar la distribución. Esto implica aumentar las contribuciones financieras y también las no financieras al ACT Accelerator, y por eso mi país, España, se comprometió en 2020 a aportar 125 millones de euros y vamos a seguir contribuyendo. España va a donar 7,5 millones de vacunas a América Latina a través del mecanismo COVAX. También, a mi juicio, resulta fundamental fortalecer las capacidades de los países receptores para procesar, para almacenar, para distribuir y también para administrar esas vacunas. Esto es especialmente pertinente en contextos frágiles y por eso es tan importante el trabajo del ACT Accelerator sobre los sistemas de salud. Además, proponemos que se cree una alianza público-privada entre aerolíneas, gobiernos, organizaciones internacionales para facilitar esta distribución. Porque solamente trabajando juntos en todas estas áreas vamos a lograr doblegar la pandemia y hacerlo sin dejar a nadie atrás. Creo que si algo hemos aprendido es que debemos fortalecer la arquitectura mundial para estar mejor preparados y hacer frente en consecuencia a los distintos desafíos globales en este ámbito. Hemos trabajado de manera muy intensa a lo largo de este último año para tomar medidas concretas. Es el momento de llevarlas a cabo. Somos partidarios de adoptar un tratado internacional que establezca los objetivos, los principios fundamentales de la acción colectiva necesaria para atajar futuras pandemias. Debemos aprovechar el impulso y el compromiso político al más alto nivel para garantizar la inversión política, también la financiera a largo plazo, que requieren precisamente este tipo de emergencias que son las emergencias sanitarias globales. Necesitamos en consecuencia un enfoque holístico que tenga en cuenta la salud humana, también la medioambiental, que son dos caras de la misma moneda y que además estoy convencido de que este tratado es la mejor forma de hacerlo realidad. Señor Director General, sabe bien que cuenta con el apoyo de España para la Organización Mundial de la Salud. También contamos, y lo hemos sentido a lo largo de estos últimos meses de pandemia, todo el apoyo de su organización. Sigan ustedes desempeñando esta labor de liderazgo. Si actuamos unidos, juntos, estoy convencido de que podremos salir más fuertes de esta crisis. Gracias.
Thank you, Excellency. I have the pleasure to now invite the Prime Minister of the Kingdom of Tonga, His Excellency, the Honorable Reverend Dr. Pohiva Tohioniti. Sir, you have the floor.
WHO Director General Dr. Tedros Ghebreyesus, President, Your Excellency Ms. Keva Bain, Your Excellencies, distinguished delegations of member states, guests, ladies and gentlemen. On behalf of His Majesty's government, I'd like to join others in welcoming us all to the 74th World Health Assembly. As I join you virtually today, I am proud to say that the Kingdom of Tonga is one of the few countries in the world to be completely COVID-19 free. Tonga activated early its national task force for COVID-19 jointly with the National Emergency Management Committee in February 2020, even before the first case was reported in the Pacific. The Joint Committee developed an action plan and issued early travel advisories, diversion orders, regulations, and policies to facilitate rapid response. Heeding WHO's warnings, we knew from the very beginning that we must act decisively to protect our people. So already by March 2020, we had declared COVID-19 a national public health emergency. We worked quickly to put infrastructure in place, refurbishing and renovating facilities to serve as quarantine and treatment centers, and establishing a brand new laboratory with gold standard RT-PCR technology. We trained our health staff, including in the outer islands, so that they would be ready to treat cases. And we scaled up mental health and psychological support to help our people cope with this difficult time. And now we are working to vaccinate the population. To date, we have reached more than 25% of our target population. Through all of this and through the cooperation of our health, His Majesty's Armed Forces, police and border control staff, along with the more than 100,000 people who make up Team Tonga, we have so far been able to keep COVID-19 at bay. Of course, none of this would have been possible if it were not for the support we received from WHO and key donor partners. WHO has been instrumental in helping us to ensure that our response measures are based on the best possible data and science. I thank Director General Dr. Tedros for his strong visionary leadership, and Western Pacific Regional Director Dr. Takeshi Kasai for his deep understanding and appropriate guidance targeted to the Pacific Island countries. In addition, we have received direct technical and financial assistance from the Asian Development Bank, Pacific Community, UNICEF, World Bank, and the governments of Australia, China, India, Japan, New Zealand, UK, and USA, along with the support provided through those behind COVAX, such as the European Union. For this, we are very grateful. On that note of collaboration, I want to take this opportunity to remind us all why we are here today. We are here brought together by the World Health Organization because we are faced by tremendous challenges that can only be addressed through collective action by all of us. Today, we face the COVID-19 pandemic, and our only way out of this is by working together. But we will face further pandemics and other issues which threatens lives, livelihoods, and health. In the Pacific, for example, we are all too aware of the increasing impacts of climate change and how it threatens our people. We cannot effectively address these issues without the convening power of a body like WHO. So, over the next 5 days, I call upon all of us to put aside our differences and come together collectively to address our common threat. Let's work together to build the sustainable systems that will ensure that all countries are able to meet future health needs. Let history show that the leaders of today had the courage to act collectively for the betterment of humanity. Only then will we be able to build for a better future for the globe, for a healthier, safer, and fairer world for all. Tuafatu.
Thank you, Excellency. I am delighted to now invite the Secretary General of the United Nations, His Excellency Mr. Antonio Guterres, to address us.
Excellencies, ladies and gentlemen, dear colleagues and friends, the COVID-19 pandemic has brought a tsunami of suffering. Over 3.4 million lives have been lost. Some 500 million jobs have gone. Trillions of dollars have been wiped from global balance sheets. The most vulnerable are suffering most, and I fear this is far from over. I pay tribute to the frontline health workers who are the heroes of this pandemic. Millions of healthcare professionals continue to put themselves in harm's way every day. We owe them our deepest appreciation. This includes our colleagues at the World Health Organization who are working around the world to support member states in saving lives and protecting the vulnerable. Excellencies, colleagues, friends, from the start of the COVID-19 pandemic, I have warned of the dangers of two-speed global response. Sadly, unless we act now, we face a situation in which rich countries vaccinate the majority of their people and open their economies, while the virus continues to cause deep suffering by circling and mutating in the poorest countries. Further spikes and surges could claim hundreds of thousands of lives and slow the global economic recovery. COVID-19 cannot be beaten one country at a time. We need coordinated global action in 3 areas to put the world on the path towards recovery and to achieve the 2030 Agenda and the Sustainable Development Goals. First, the world must respond resolutely and in solidarity to stop the virus. World leaders must urgently step up with a global plan for equitable access to COVID-19 vaccines, tests, and treatments. This starts with funding the ACT Accelerator and its COVAX facility to deploy life-saving tools to the poorest countries on a global scale. But that is not enough. We are at war with the virus. We need the logic and urgency of a war economy to boost the capacity of our weapons, the vaccines. On Friday, I called on the G20 to set up a task force that brings together all countries with vaccine production capacities, the World Health Organization, the ACT Accelerator partners, and international financial institutions able to deal with the pharmaceutical companies and other key stakeholders. It should aim to at least double manufacturing capacity by exploring all options, from voluntary licenses and technology transfers to patent pooling and flexibility on intellectual property rights. The task force should address equitable global distribution by using the ACT Accelerator and its COVAX facility. And it should be co-convened at the highest levels by the major powers who hold most of the global supply and production capacity, together with the multilateral system. I am ready to mobilize the entire United Nations to support these efforts. Second, we must bolster primary health care systems and universal health coverage. COVID-19 cannot be seen in isolation from the fundamental problems with our health systems: inequality, underfunding, complacency, neglect. With the right primary health care systems in place, we will recover more quickly from this pandemic and prevent the next before it takes hold. Our efforts to recover from COVID-19 should not come at the cost of other essential health care, from women's reproductive services to children's vaccination and mental health coverage. Third, we must prepare for the next global health emergency. Robust primary health systems are a start, but they are not enough. I fully support the bold recommendations in the recent report by an independent panel for pandemic preparedness and response. The world needs political commitment at the highest level to transform the existing systems through an international coordinated all-of-government and society approach. The WHO must be at the heart of global pandemic preparedness. It needs sustainable and predictable resources, and it must be fully empowered to do the job that is demanded of it. We need a framework for international cooperation and solidarity fit for the future. New solutions for sustainable and predictable financing. National capacity for prevention, detection, and responses to disease outbreaks. Excellencies, colleagues, friends, COVID-19 must be a turning point. Your deliberations at this 74th World Health Assembly will be critical to set the highest level of ambition. I urge you to take the bold decisions necessary to end this pandemic and build safe, healthy communities and societies for the future. Thank you.
Thank you, Mr. Secretary General. Finally, I have the pleasure to invite Mr. Kailash Satyarthi, a child rights activist and Nobel Peace Laureate, to give his statement. Mr. Satyarthi, you have the floor.
Madam President, Director General Dr. Tedros, Honorable Ministers and distinguished delegates, my dear children of the world. Let me begin with a Sanskrit prayer. Sarve bhavantu sukhinah sarve santu niramaya sarve bhadrani pashyantu ma kaschid dukh bhag bhavet. Om Shanti. May all be happy. May all be free from illness. May all see what is auspicious. May no one suffer. May peace prevail. My dear sisters and brothers, today we remember those who we have lost to the pandemic. We also pay tribute to our health and frontline workers for their great sacrifice. I thank my dear brother Dr. Tedros for inviting me to speak at this August Assembly. I commend his leadership and applaud his team for their relentless work in fighting the pandemic. I also extend my appreciation to respected health ministers for their work. Today I am here as the voice of the millions of voiceless children who are left behind. They are the children who live with intergenerational poverty and hunger. The same children are forced to work and sell their bodies. They are the same who face the worst health outcomes and denied education. They have little access or no access to clean water and sanitation. They have been exploited for decades and centuries. Therefore, this 74th World Health Assembly will be a defining time in our society and in the history. It gives us the opportunity to take a moment to evaluate the choices we have made and their human cost, and to consider the choices we have today. What are the choices we have made? $8 trillion have been released as COVID response fund in 2020. But only a disgraceful 0.13%, I repeat 0.13% was allocated to the most marginalized communities through multilateral assistance. Wealthy countries chose to cut down their ODA budgets for low-income countries that face immeasurable misery. The pandemic is not only a health or economic crisis, dear friends, it is a crisis of justice, crisis of civilization, and a crisis of humanity. What have we lost as a result of these crises? While the world has suffered as one, we have not suffered equally. 2/3 of the world's largest companies made an additional $109 billion in 2020. At the same time, 140 million children and their families will be pushed into acute poverty. This is unacceptable. This is injustice. They are invisible children of the world who, instead of being in their classrooms, are living on the streets, trapped into workshops and brothels, orphaned and abused, living in institutions, conflict zones, and refugee camps. They are children from the same communities that have faced generations of racial discrimination, injustices, and violence. Friends, they are the children who are working in cocoa fields of Ghana and Ivory Coast, and the children in Colombia's coffee fields. They face the health impact of the increasing use of pesticides, machine and electricity, beside injured limbs and muscle damage. They are 10-year-old Nageswar who lost his speech from the trauma and torture at the hands of his employer. I have heard the children scream in their sleep and the deafening silence in the day. My organization in India has rescued over 100,000 child laborers in the last 4 decades. Let me tell you that most of these rescued children were suffering various health problems, different ailments, diseases, burns, weak teeth and eyesight, malnutrition, developmental challenges, tuberculosis, and so on. The health impact of child labor is felt throughout the life. Today, we have, unfortunately, 152 million children working at the cost of their childhood and freedom in the world. But due to this pandemic, the number is now set to increase in millions more for the first time in decades. Therefore, what choices lie ahead of us? Experts have warned that the next wave is likely to target children. This is what we know today. We cannot wait for the house to be on fire again for us to have the extinguishers ready. If we don't learn from our mistakes, we will not be losing our people because of the virus, but because of our lack of preparedness, apathy, and complicity. We have to build back better for our future. The COVAX initiative is a step in the right direction, but only compassionate politics and moral leadership can give it any meaning. Wealthy nations must support economically excluded communities by making COVAX inclusive, democratic, and well-resourced. If there is one thing we have been forced to learn today, is that till everyone is safe, none of us are safe. It is true of both people and nations. It is the hour of crisis that true character of leaders is demonstrated. Every child deserves their fair share of the world. We need urgent and accountable action to protect them. So, I call upon agencies of the United Nations must stand united now. This is the time to act with the true spirit of multi-sectoral partnership for children. In this regard, I recommend an interagency high-level group to recommend concrete and time-bound actions to safeguard our children who are directly or indirectly affected by COVID. Secondly, I demand the waiver of all intellectual property restrictions on COVID vaccines manufacturing, democratization of technical knowledge, and access to raw material. Perhaps you are aware that 170 former world leaders and Nobel laureates recently demanded the waiver of intellectual property restrictions on COVID vaccines. I thank President Biden for supporting this demand. Other countries must also do the same. Thirdly, protect our children now and from immense mutations of the virus. We have seen the devastating situations in India, United States, Brazil, and Nepal. It is possible anywhere in the world. We hope to organize focused consultations with the experts to support the efforts of WHO and national governments to protect the most left behind children from this virus. Finally, I call on you, respected health ministers, to create budgeted action plans and constitute task forces to reach the poorest and most marginalized children in your countries. This will ensure vaccination, pediatric facilities, and social protection floors. High-income countries must support this. In addition, I ask you, please, don't amplify superstitions around COVID and vaccines, and stick to best scientific knowledge. Dear sisters and brothers, we are at a crossroads, and generations will pay the price of our choices we make today. Profit, politics, and property can wait, but not our children. Their freedom, safety, and childhood cannot wait. If we leave entire populations of children behind, any investment in healthcare will fall through the cracks between one generation and the next. Dear sisters and brothers, I call upon you, let us globalize compassion for our children. Let us globalize compassion as we move forward from the wreckage of this pandemic. Let us take all our children with us. Thank you.
Thank you, Mr. Satyathi. We would like to sincerely thank all our distinguished guests for their words of encouragement and solidarity. It is my honor to now invite the Director General of the World Health Organization, Dr. Tedros, to address us. You have the floor.
Thank you. Your Excellency, Madam President, Ambassador Keva Bain, Your Excellency Alan Berset, Federal Councillor of Switzerland, Excellencies, distinguished colleagues and friends. Lucy Naimbura is a health promotion officer in Mombasa City, Kenya. When COVID-19 arrived last year, a strict lockdown was introduced, but it was met with strong resistance by the local community, who refused to be tested, isolated, or treated. And Lucy made her daily rounds, providing information about the dangers of the new virus. Lucy was insulted in the streets, and she and her team sometimes had to stop working for their own safety. But Lucy kept going back to the community. After weeks of engaging leaders, things started to change. Communities started following COVID-19 guidelines and accepted to be tested. The spread of the virus was curtailed and the lockdown was removed. Asante sana, Lucy. Dr. Gansengel Purev is an intensive care specialist in the Central Military Hospital in Ulaanbaatar, Mongolia. This is what he said. During my first shift, I lost my grandmother to COVID-19. She died in my arms. During my last shift, 3 people died in an hour. My patients are no different to my grandmother and grandfather. Many patients recover and leave the hospital. What keeps me going is 2 words from them: thank you. Dr. Catalin Dancio is an intensive care specialist in Romania. He was on duty in November last year, caring for patients with COVID-19 when a fire broke out in the hospital. 10 patients died in the fire, and in trying to save others, Dr. Dancio suffered third-degree burns to 40% of his body. Today, we will honor him with an award for his service, sacrifice, and example. These are just a few examples. There are millions more stories of courage, heartbreak, desperation, struggle, and triumph. For almost 18 months, health and care workers all over the world have stood in the breach between life and death. They have saved countless lives and fought for others who, despite their best efforts, slipped away. Many have themselves become infected, and while reporting is scant, we estimate that at least 115,000 health and care workers have paid the ultimate price in the service for others. Health and care workers do heroic things, but they are not superheroes. They are humans like the rest of us. They sweat and swear. They laugh and cry. They fear and hope. Many feel frustrated, helpless, and unprotected, with a lack of access to personal protective equipment and vaccines and the tools to save lives. In this International Year of the Health and Care Worker, we have all been reminded that these are incredible people doing incredible jobs under incredible circumstances. We owe them so much. And yet, globally, health and care workers often lack the protection, the equipment, the training, the decent pay, the safe working conditions, and the respect they deserve. The job can be dangerous and disheartening, but it can also be the best job on earth. A year ago, we published the first State of the World's Nursing Report, and just last week, we launched the third State of the World's Midwifery Report, showing the world faces a global shortage of 900,000 midwives. If we have any hope of achieving a healthier, safer, fairer future, every member state must protect and invest in its health and care workforce as a matter of urgency. This week, you will consider 2 draft resolutions on the health workforce. I hope you will adopt them and, more importantly, take action on them in every country. Just as health and care workers are the lifeblood of every health system, so the lifeblood of WHO is its staff. The incredible people all over the world I'm honored to call my colleagues in country and regional offices and here at headquarters. For almost 18 months, they have worked under extreme pressure, and time again, they have gone above and beyond to serve you, our member states, despite the modest resources they have to do their jobs. The success of this organization depends on its people, and we're committed to doing much more to build a WHO that attracts the best and gives them the best opportunities in the best working environment. As you know, the regional directors and I have made 2021 the year of the WHO workforce. As part of our commitment to strengthening the health and care workforce globally, as well as our own workforce, the WHO Academy will be a major addition to global health learning, as President Macron indicated earlier. The Academy's digital learning platform has been built and will begin global testing next week. The first batch of learning programs are in the final stages of production, translation, and testing, and will be rolled out by September. With thanks to France for its support, we're moving forward with plans to build the WHO Academy campus in Lyon. Today, I ask you not for a moment's silence, but to make the loudest noise you can. Please join me in clapping, shouting, and stamping your feet for every health and care worker everywhere. Thank you very much. Excellencies, although we have lost so many health and care workers already, we will lose many more as long as the pandemic rages. Almost 18 months into the defining health crisis of our age, the world remains in a very dangerous situation. As of today, more cases have been reported so far this year than in the whole of 2020. On current trends, the number of deaths will overtake last year's total within the next 3 weeks. Since our health assembly started this morning, almost 1,000 people have lost their lives to COVID-19. And in the time it takes me to make these remarks, a further 400 will die. This is very tragic. We're pleased that for 3 consecutive weeks, though, we have seen a downturn in the number of cases and deaths being reported. But globally, we remain in a fragile situation. No country should assume it's out of the woods, no matter its vaccination rate. So far, no variants have emerged that significantly undermine the efficacy of vaccines, diagnostics, or therapeutics. But there is no guarantee that will remain the case. This virus is changing constantly. Future changes could render our tools ineffective and drag us back to square one. We must be very clear. The pandemic is not over, and it will not be over until and unless transmission is controlled in every last country. WHO Strategic Preparedness and Response Plan sets out the 10 pillars that every country must apply in a tailored and dynamic way to reduce exposure, prevent infections, limit the spread, and save lives. Every country can do more. Increase surveillance, testing, sequencing, sharing information, surge supplies needed to protect health workers, fight misinformation and disinformation, empower people and communities to play their part, support businesses and workplaces to take steps to open up safely where appropriate, implement national vaccination strategies, vaccinate those most at risk, and donate vaccines to COVAX. The ongoing vaccine crisis is a scandalous inequity that's perpetuating the pandemic. More than 75% of all vaccines have been administered in just 10 countries. There is no diplomatic way to say it. A small group of countries that make and buy the majority of the world's vaccines control the fate of the rest of the world. The number of doses administered globally so far would have been enough to cover all health workers and older people if they had been distributed equitably. We could have been in a much better situation. I understand that every government has a duty to protect its own people. I understand that every government wants to vaccinate its entire population. That's what we want to. And in time, there will be enough supply for everyone, including those at lower risk. But right now, there is not enough supply. Countries that vaccinate children and other low-risk groups now do so at the expense of health workers and high-risk groups in other countries. That's the reality now. At the executive board meeting in January, I issued a challenge to see vaccination of health workers and older people underway in all countries within the first 100 days of the year. That target was very nearly achieved, but the number of doses available to COVAX remains vastly inadequate. COVAX works. We have shipped every single one of the 72 million doses we have been able to get our hands on so far to 125 countries and economies. But those doses are sufficient for barely 1% of the combined population of those countries. So today, I'm calling on member states to support a massive push to vaccinate at least 10% of the population of every country by September, and a drive to December to achieve our goal of vaccinating at least 30% by the end of the year. This is crucial to stop severe disease and death, keep our health workers safe, reopen our societies and economies. Sprinting to our September goal means we must vaccinate 250 million more people in low and middle income countries in just 4 months, including all health workers and the most at-risk groups as the first priority. These are the minimum targets we should aim for. At the G20 Global Health Summit on Friday, IMF Managing Director Kristalina Georgieva proposed vaccinating 40% of the world's population by the end of the year and 60% by mid-2022. We're in discussions with the IMF member states and our partners about how to make these ambitious targets achievable. Here is how the drive to December must happen. First, share doses through COVAX now. I welcome the commitments made by member states to donate doses, including the important announcements made at the G20 Global Health Summit on Friday. But to achieve the goals for September and the end of the year, we need hundreds of millions more doses. We need them to go through COVAX, and we need them to start moving in early June. Manufacturers must play their part by ensuring any country that wants to share doses through COVAX can do it within days, not months. I call on all manufacturers to give COVAX first right of refusal on new volume of vaccines, or to commit 50% of their volumes to COVAX this year. And we need every country that receives vaccines to use them as quickly as possible. No dose can lay idle, or worse, be thrown away. Country-level preparations to reach their populations must move as fast as vaccines. Second, scale up manufacturing. The bottom line is that we need a lot more doses. We need them fast, and we must leave no stone unturned to get them. Several manufacturers have said they have capacity to produce vaccines if the originator companies are willing to share licenses, technology, and know-how. I find it difficult to understand why this has not happened yet. I thank India and South Africa for their initiative at the World Trade Organization to waive intellectual property protections for COVID-19 products. And I thank those countries that are supporting these efforts. And we urge member states and manufacturers to join CETAP, the WHO COVID-19 Technology Access Pool, which provides a powerful mechanism for sharing licenses in a non-exclusive, transparent way. I thank Prime Minister Pedro Sanchez for his commitment that Spain will join CETAP, and we expect more good news in the coming days. And third, fully fund the ACT Accelerator. There remains an $18.5 billion gap in the ACT Accelerator. Ultimately, the pandemic has shown clearly that in an emergency, low and lower middle income countries cannot rely on the imports from vaccine-producing countries. I welcome the draft resolution on strengthening local production of medicines and other health technologies that member states will consider at this assembly. I would also like to take this opportunity to express my deep appreciation to President Biden for reversing the decision to take the United States out of WHO, and also for donating $4 billion to COVAX, and also for their announcement that they will donate 80 million vaccines doses globally. These are the largest contributions ever, and also for supporting the intellectual property waiver. In November, I gave member states a detailed description of the incredible breadth and depth of WHO's work beyond the pandemic. In the 6 months since then, there have been even more achievements to be proud of. As part of our commitment to transparency, the 2021 results report provides a wealth of information in an interactive, engaging, easy-to-use digital format. I commend it to you. As a complement to the results report, we held the Triple Billion showcases, updated the Triple Billion dashboard, and we continue to hold ourselves accountable through delivery stock takes to review progress and identify challenges. We have built the World Health Data Hub to provide complete, transparent, and open data on an interactive and easily searchable platform. And the annual World Health Statistics published last week presents the latest data on more than 50 health-related indicators for the Triple Billion targets and the Sustainable Development Goals. Among its other findings, preliminary estimates suggest there were at least 3 million excess deaths globally in 2020 attributable either directly or indirectly to COVID, representing 1.2 million more deaths than the 1.8 million officially reported. One of the features of the 13th General Program of Work and the WHO transformation is to drive a paradigm shift in global health by increasing the emphasis on promoting health and preventing disease, focusing on healthy lifestyle. On current trends, we estimate that about 900 million more people could be enjoying better health and well-being by 2023, taking us very close to our target of 1 billion. But progress is uneven, and more than a third of countries are heading in the wrong direction. We have made mixed progress in addressing the major risk factors for non-communicable diseases. Tobacco use continues to decline, but the prevalence of obesity is rising, and is alcohol consumption in some regions. At the beginning of this year, WHO launched a year-long campaign called Commit to Quit, to encourage at least 100 million of the world's 1.3 billion tobacco users to quit. 6 weeks ago, we released our technical manual on tobacco tax policy and administration. Many countries are showing leadership in this area and in implementing the other measures in the Empower package of interventions. The Gambia has just increased its tobacco excise tax rates. Bolivia passed a comprehensive tobacco control law, and with WHO support, 6 African countries banned smoking in public places and on public transport. We also see progress in efforts to improve nutrition and to support consumers to make healthier food choices. Last year, we launched a program to certify countries that have eliminated trans fats from their food supply, and 14 countries have now introduced best practice policies on trans fats protecting 589 million people from their harmful effects. Earlier this month, we published new benchmarks for sodium content in more than 60 categories of food, and last year, Mexico implemented front-of-pack labeling. On occupational health, we worked with the International Labour Organization to develop guidance to protect workers from COVID-19. We're working with the UN Environment Programme to support 40 countries to establish legally binding controls on lead paint, a significant source of childhood poisoning. Together with UN partners, in March of this year, we published the first global report on ageism. A month ago, we released a new technical package called Step Safely to prevent and manage falls, an increasing cause of death and disability for people of all ages. In April, UN member states adopted a resolution committing to greater efforts to prevent drowning in line with WHO recommendations. With UN Women, we launched a new report representing the largest study ever conducted on the prevalence of violence against women, showing that almost 1 in 3 women globally has suffered intimate partner violence, sexual violence from a non-partner, or both at least once in their lives. With our partners at FAO, OIE, and UNEP, we created the One Health high-level expert panel, which met for the first time last week, and the panel will be instrumental in guiding development of a dynamic new research agenda and providing high-level policy leadership. Despite these achievements, progress in addressing the root cause of death and disease remains vastly insufficient and inequitable. Globally, only 3% of health budgets are spent on promotion and prevention. And yet, increased investment in these areas could reduce the global disease burden by half, generating massive returns for individuals, families, communities, and nations. An investment of $1 per person per year could save 8.2 million lives and $350 billion by 2023. The pandemic has been a significant setback in our efforts to support member states to progress towards universal health coverage, as you know. On current trends, we project that an additional 290 million people will have access to high-quality health services without financial hardship by 2023. That leaves a shortfall of 710 million against our target to see 1 billion more people benefiting from universal health coverage. The world is far behind. With renewed determination and increased investment in primary health care and public health, we estimate that a further 400 million people could be covered with essential services by 2025. But at least half the world's population still lacks access to these services. According to our most recent estimates, about 930 million people suffer catastrophic health spending each year, and about 90 million are pushed into extreme poverty by out-of-pocket health spending. Globally, there remain huge gaps in access to essential medicines, including antibiotics, insulin, antihypertensives, diagnostics and treatment for cancer, and routine immunizations. Antimicrobial resistance remains an existential and largely unaddressed threat to a century of medical progress. And although we have seen a steady increase in service coverage over the last few years, the pandemic has caused severe disruption to essential health services. Our most recent Pulse survey, published 1 month ago, shows that during the first 3 months of this year, 94% of the 135 countries and territories surveyed reported some kind of disruption to services. To give one example, data published in March suggests an estimated 1.4 million fewer people received care for TB last year, 21% less than in 2019. This disruption could cause an additional 500,000 deaths. 60 mass immunization campaigns are currently postponed in 50 countries, putting around 228 million people, mostly children, at risk for measles, yellow fever, polio, and more. However, we do see signs of recovery. And despite disruptions to services, there have been significant achievements. Globally, the prevalence of hepatitis B virus in children under 5 years is now below 1%, meaning the SDG target has already been achieved. More than 9.4 million people globally have received treatment for hepatitis C, a 9-fold increase since 2015. And this week, we will publish interim guidance for validation of viral hepatitis elimination, with assessments to start in Brazil, Egypt, Georgia, Mongolia, and Rwanda. 10 days ago, the Commonwealth of Dominica received certification for the elimination of mother-to-child transmission of HIV and congenital syphilis. On malaria, although the global decline in infections and deaths has stalled, there are still causes for celebration. In February, El Salvador became the first country in Central America and the 39th country or territory globally to be certified as malaria-free. More than 670,000 children have now received the first dose of RTS malaria vaccine in Ghana, Kenya, and Malawi as part of a pilot program coordinated by WHO, with financial support from Gavi, UNITAID, and the Global Fund. Preliminary results are very positive. On tuberculosis, more than 20 million people received access to TB services over the past 2 years, almost 5 million more than the previous 2 years. 109 countries started using new effective TB drugs, while 89 countries reported using better and faster treatments for multi-drug resistant TB in line with updated WHO treatment guidelines. On neglected tropical diseases, we have a new roadmap that sets global targets and milestones to prevent, control, eliminate, and eradicate 20 neglected tropical diseases and disease groups. So far this year, only 3 human cases of guinea worm disease have been reported, compared with 17 of the same period last year. Last month, Gambia eliminated trachoma as a public health problem, while in March, Cote d'Ivoire became the second country after Togo to eliminate African trypanosomiasis. On non-communicable diseases, WHO has supported 36 countries to integrate services to prevent, detect, and treat NCDs into primary healthcare programs. More than 30 countries have developed policies or programs to improve access to childhood cancer care. We launched the Global Breast Cancer Initiative, aimed at reducing mortality from the world's most diagnosed cancer by 2.5% every year until 2040, saving 2.5 million lives. More than 3 million people in 18 countries are now on protocol-based management of hypertension, with increasing use of the WHO HEARTS package of interventions. And we have launched a new project to link quality of care for maternal and child health with NCDs. On mental health, we have supported 31 more countries to integrate mental health services into primary health care, a 100% increase since 2014. To improve mental health among adolescents, we worked with UNICEF to launch the Helping Adolescents Thrive Toolkit. To address opioid overdose deaths, we worked with UNODC to conduct a study of naloxone in 4 low and middle-income countries, demonstrating significant public health benefits. On access to medicines, WHO has given emergency use listing to 7 vaccines and 28 in vitro diagnostics for COVID-19, which has allowed 101 countries to issue their own regulatory authorizations. In total, WHO pre-qualified 62 medicines, 15 diagnostics, 13 vaccines, and more last year, the most in a single year. In January, we published the updated model list of in vitro diagnostics, including new tests for non-communicable and infectious diseases. We published new pricing policy guidelines to increase the affordability of medicines, and we supported small island developing states to sign a pooled procurement agreement for health products to improve the prices at which they can buy medicines, vaccines, and other products. Through the WHO Listed Authorities Initiative, Ghana achieved maturity level 3 last year, meaning it has a stable and well-functioning regulatory system. In future, it will be able to become a reference agency for issuing marketing authorizations in Africa and beyond. WHO is also supporting the Africa Union to establish the Africa Medicines Agency to increase regulatory oversight and access to safe, efficacious, and affordable medical products across the continent. On antimicrobial resistance, just last month, WHO published the latest overview of the pipeline for antibacterials to monitor progress in research and development of these life-saving treatments. The number of countries reporting data to the Global Antimicrobial Resistance and Use Surveillance System has tripled to 70 in 3 years, and the number of surveillance sites globally has increased from 729 to 73,000. And we published the One Health Global Leaders Group on Antimicrobial Resistance, led by Prime Minister Hasina of Bangladesh and Prime Minister Motley of Barbados. And finally, we estimate that by 2023, about 920 million people could be better protected from health emergencies. Again, taking us very close to reaching our target of 1 billion. Of course, that doesn't mean 920 million people protected from all health emergencies. The past year has exposed gaps in national and global preparedness that must be addressed. Even while WHO has focused on responding to this pandemic, we continue to work with countries to prepare for a possible influenza pandemic. Finally, today also marks the 10th anniversary of the Pandemic Influenza Preparedness Framework, pioneered a new approach to sharing biological materials and to equity of access to vaccines and other critical pandemic response products. More broadly, we continue to assess preparedness and response capacities of member states with 113 joint external evaluations, 156 simulation exercises, and 126 intra-action or after-action reviews. More than 70 countries have developed national action plans for health security to address critical gaps, but many remain unfunded. And of course, COVID-19 is far from the only emergency to which WHO has responded in the past year. Every month, WHO processes over 9 million pieces of information, screens 43,000 signals, leading to 4,500 events reviewed and an average of 30 events verified. Our surveillance systems go far beyond disease outbreak events in human populations to encompass information with potential risk implications at the human-animal interface, signals related to climate change, industrial hazards, and conflicts. In 2020 alone, we responded to over 120 emergencies, including a total of 60 graded crises. More than 1.8 billion people currently live in fragile, conflict, and vulnerable settings where protracted crises are compounded by weak national capacity to deliver basic health services. As the health cluster lead in the United Nations humanitarian response, WHO leads efforts to deliver the public health response to COVID-19 through the Global Humanitarian Response Plan, providing coordination and operational support in 30 countries in partnership with 900 national and international partners. These populations are also the ones that are most at risk to outbreaks of cholera, meningitis, yellow fever, and other high-threat infectious hazards. Health and care workers are particularly vulnerable where there is instability. More than 2,400 incidents in 17 countries and territories have been recorded by the surveillance system for attacks on healthcare since it started in December 2017. Over 600 healthcare workers and patients have died, and nearly 2,000 have been injured. There is no space, there is no peace without health, and no health without peace. All of these efforts are supported by our science and data divisions, which monitor progress and stay abreast of the rapidly evolving evidence. The science division quality assure more than 290 global public health goods this biennium, and together with the Health Emergencies Program, coordinated the review of almost 1,300 COVID-19 publications. We're also working to ensure our products are tackled and designed for impact. Among WHO's most downloaded products in the past year included new guidelines on increasing physical activity, rapid advice on the use of chest imaging in COVID-19, technical specifications for blood pressure measurement, managing chronic pain in children, pharmaceutical pricing policies, traditional and complementary medicines, and screening and treatment for prevention of cervical cancer. In addition, new reports on tuberculosis, nursing, malaria, cancer, NCDs, neglected tropical diseases, antimicrobial resistance, and the annual World Health Statistics provide an authoritative snapshot on vital health issues. I know it's a long list, but we want to remind all member states of the vast range of work we do to address the vast range of health challenges we face. Many of these issues are on your agenda this week, and none of them does WHO work alone. Partnership is essential to everything we do, including in the multilateral system through the Global Action Plan for Healthy Lives and Well-being for All. Today, we're launching the Global Action Plan Progress Report entitled Stronger Collaboration for an Equitable and Resilient Recovery. We're committed to accountability for the results we achieve, but also for how we work, which is why any report of sexual exploitation and abuse by our staff cannot be tolerated. We recognize that we must do much more to protect the people we serve and to ensure that zero tolerance is not just a slogan, but a mark of who we are. Excellencies, colleagues, and friends, this pandemic has been driven by a highly transmissible virus. But it has been turbocharged by division, inequity, and the historical neglect of investments in preparedness. So, as we recover and rebuild, we must do more than stop viruses. We must address the vulnerabilities that allow outbreaks to become epidemics and epidemics to become pandemics. We can come up with new institutions and new mechanisms, but that may only paper over the cracks. Whatever changes we make must be something more fundamental. We can only lay a solid foundation for a safer world with a common commitment to solidarity, equity, and sustainability. A year ago, you tasked me with initiating an impartial, independent, and comprehensive evaluation, including existing mechanisms as appropriate, to review experience gained and lessons learned from the WHO coordinated international health response to COVID-19. At this health assembly, you will receive the reports of several panels and committees that evaluated different dimensions of the international response to the pandemic, including WHO's role. I would like to thank each panel, committee, and working group for its efforts. We welcome each of these reports, and we look forward to discussing them with member states this week. There is always more to do. There are more lessons to learn and more changes to make. We're committed to listening to you, our member states, with humility and a willingness to make the changes we need to be the organization you need us to be. Many of you have recognized that a significant increase in more predictable and sustainable financing is needed to enable WHO to fulfill your expectations. But beyond how this organization is funded, the world needs a fundamental rethink by what we mean by global health security. We cannot build a safer world from the top down. We must build from the ground up. Preparing for, preventing, detecting, and responding rapidly to epidemics doesn't start in Geneva, New York, or any of the world's corridors of power. It starts in the streets of deprivation and overcrowding, in the homes where there is not enough food, in the communities without access to health workers, and in the villages and towns whose clinics and hospitals lack electricity or clean water. It starts with strong primary health care and public health systems, skilled health workers, and communities empowered and enabled to take charge of their own health. That must be the focus of our attention and our investment. We need better systems, built locally and linked globally in an unbreakable chain for readiness, early warning, rapid response, risk communications, and more. Already, we have taken several steps to build these systems. We are now preparing to start a pilot program of the Universal Health and Preparedness Review with 12 member states during the second half of this year. We have announced plans to establish the WHO Hub for Pandemic and Epidemic Intelligence in Berlin. We're preparing to open the doors of the WHO Academy. We're already building on lessons from the WHO-hosted Accelerator, which will need to be a pillar of the new international system. And just this morning, I signed a memorandum of understanding with His Excellency Alain Berset on establishing the BioHub here in Switzerland as a reliable, safe, and transparent mechanism for member states to voluntarily share pathogens and clinical samples. Second, we need better financing to strengthen national capacities, support rapid response, and fund the research and development, manufacturing, and deployment of life-saving tools. The world has several strong international financial institutions that must play a vital role in funding an enhanced national and global health security system. And third, We need better governance that's inclusive and truly representative of every member state, regardless of the size of its population or economy. Keeping the world safe requires the ownership and engagement of all member states. The international health regulations remain the cornerstone of global governance for pandemic preparedness and response, but their implementation is inconsistent and have not led to the level of commitment and action needed. We all know that one of the greatest drivers of this pandemic has been the lack of international solidarity and sharing data, sharing information, sharing pathogens, sharing resources, sharing technology. We can only address that fundamental weakness with a binding commitment between nations to provide a solid foundation for enhanced cooperation, a treaty on pandemic preparedness and response that can address the challenges that I have outlined. An international agreement that represents all nations and people, that addresses our shared risks and vulnerabilities, that leverages our shared humanity, solidarity, and diversity, and that reflects what future generations need, not what these generations want. Excellencies, we have come to a fork in the road. If we go on the same old way, we will get the same old result. A world that's unprepared, unsafe, and unfair. Make no mistake, this will not be the last time the world faces the threat of pandemic. It's an evolutionary certainty that there will be another virus with the potential to be more transmittable and more deadly than this one. This is not the time for incremental improvements or tinkering at the edges. This is the moment for bold ideas, bold commitment, and bold leadership, for doing things that have never been done before. We have a choice between cooperation, competition, or confrontation. In fact, the only choice we have is between cooperation and insecurity. A safer world is not a zero-sum game. It is the opposite. If anyone is left behind, all are held back. But if the farthest behind is the first to be helped, if the weakest is first to be strengthened, if the most vulnerable is first to be protected, then we all win. 73 years ago, our member states, established WHO as the directing and coordinating authority on international health. And with your continued leadership and guidance, that's the role we will continue to play together to promote health, keep the world safe, and serve the vulnerable. Shukran jazilan, sheshe, merci beaucoup, muchas gracias, spasiba balshoy, and thank you very much. Thank you. So just one thing, a thanksgiving to our President, Madam President, Ambassador Keva Bain, for her able leadership in the past 1 year during her presidency. Thank you so much, Madam President, to you and to the Bahamas. And we had a very good working relationship, and you led us very well, and we're very grateful for that. And thank you so much, and look forward to continue working closely with you. So thank you so much.
Thank you, Director General Dr. Tedros, and thank you for your kind words. Excellencies, ladies and gentlemen, distinguished guests, I am informed that the Director General would like to recognize the contribution of a few individuals for their exceptional endeavor and commitment to health. I will now turn the floor over again to Dr. Tedros. You have the floor, sir.
Thank you, Madam President. As you all know, the pandemic has brought exceptional challenges to health and care workers in every country. For those who have displayed so much courage and have made so many personal sacrifices to help others, 2021 has been designated the Year of Health and Care Workers, with the themes of Protect, Invest, Together. In this year's Director General's Award, I would like to celebrate 3 individuals for their contributions in the field of healthcare. The first recipient is former First Lady Rosalind Carter.
my country, there has been great concern about the mental health of school children, isolated elderly parents, first responders, business owners, people who are out of work, and those recovering from illness. Practically everyone has been touched. My hope is that this is the moment when all nations will make behavioral health a priority and create quality systems of care that are equitably delivered. I've been waiting a long time to see this happen. I urge all of you attending to use your influence and talent to ensure that it does. While I regret that I cannot accept in person, I'm deeply grateful for this moving gesture of support and for your outstanding work to make a positive difference in the world. With best wishes, sincerely, Rosalind Carter. And I can assure you that those are heartfelt words. On behalf of my grandmother and our entire family, thank you to the World Health Organization for all that you've done, and particularly for honoring my grandmother's 50 years of service. Thank you.
Thank you. So next is Dr. Catalin Dancio from Romania, who rescued COVID-19 patients from an intensive care ward during a hospital fire in late 2020, even as he sustained severe burns himself.
Alô. Bom dia. Ahorita vai. Thanks.
Sunt impresionat și foarte emoționat să primesc recunoașterea muncii și a contribuției mele din partea Organizației Mondiale a Sănătății. Nu m-am așteptat nicio clipă la acest gest. Îi mulțumesc directorului general Tedros pentru acordarea acestei distincții și directorului regional Kluge pentru nominalizarea mea. Vreau să le mulțumesc din inimă colegilor belgieni, datorită cărora mă aflu aici în fața dumneavoastră. Sunt onorat să accept această distincție în numele întregului personal medical din România și din toată lumea, aflat în linia întâi de luptă. De asemenea, primesc acest premiu în numele tuturor pacienților COVID care au cunoscut suferințele bolii și în numele familiilor noastre care stau alături de noi la bine și la greu. Nu sunt un om care să vorbească mult, așa cum am spus, consider că mi-am făcut datoria față de pacienții și de colegii mei. Haina de doctor vine cu responsabilități și așteptări uriașe. Vă îndemn să fiți alături de personalul medical, să-l sprijiniți și să luptați împreună cu el pentru a învinge pandemia. Eroi sunt cei care zi de zi, de mai mult de un an, continuă în ciuda tuturor greutăților să fie alături de pacienți și de familiile lor. Este un premiu al celor rezistenți, al celor care nu cedează și al celor care merg mai departe. Și sunt mândru să fiu unul dintre acești oameni. Sănătatea este o victorie împotriva suferinței și a bolii. Împreună vom învinge.
Thank you, thank you. Our third recipient is Dr. Jemima Kariuki from Kenya for her years of work on maternal and child health, preventive medicine, and public health advocacy.
My name is Dr. Jemima Kariuki, a young Kenyan doctor undertaking my postgraduate studies in obstetrics and gynecology at the University of Nairobi in Kenya. Wheels for Life is a project I formed in response to the cries of many women who I noted were dying from preventable causes or coming with pregnancy-related complications at the peak of the pandemic because they lacked the means to reach hospitals, especially during the curfew hours, enforced by the government to try to curb the spread of coronavirus infection. Since its inception, we have been able to respond to the calls of over 100,000 pregnant women, with 98% receiving the help they needed successfully. I wish to take this opportunity to thank the World Health Organization and especially Director General Dr. Tedros Adhanom for recognizing this effort. This award, which I receive with excitement and gratitude, confirms that anyone can do it, that we all have a part to play, and that even the young are not left behind in making an impact in the world, starting with our humble ideas. I wish to recognize my partners in this venture, my colleagues who agreed with the idea right from the beginning and volunteered their time and resources to respond to the call from the needy mothers without expecting any reward. Finally, I wish to thank God, my anchor and strength, and the initiator of this idea, and my family, without whom this would not have been possible. Women carry the life force of humanity, and it is beyond painful when we lose mothers to preventable means. I firmly believe that we can bring preventable maternal deaths to zero, and I know this is part of the solution. With nurturing, Wills for Life can be integrated to healthcare systems to help reduce the death of many women. Thank you.
Asante sana Jemima, and thank you all for your contributions to promoting health, keeping the world safe, and serving the vulnerable. And again, congratulations to all recipients of today's award. You are an inspiration to us all, and I thank you again. Madam President, back to you.
Thank you, Dr. Tedros. Excellencies, ladies and gentlemen, distinguished guests, this brings us to the end of our high-level welcome. We shall now move to Agenda 1.1, Appointment of the Committee on Credentials. The Assembly is required to appoint a Committee on Credentials in accordance with Rule 24 of the Rules of Procedure of the Assembly. In conformity with this rule, I propose for your approval the following 12 member states: Andorra, Australia, Cameroon, Haiti, Iceland, Mali, Monaco, Namibia, Panama, Singapore, Somalia, and Thailand. Is this proposal acceptable? As I see no comments, I declare the Committee on Credentials, as proposed by me, appointed by the Assembly. Subject to the decision of the General Committee, the Committee on Credentials will hold its meeting virtually on Tuesday, the 25th of May at 1300 CET. Let us now turn to the election of the President. In accordance with Rule 25 of the Rules of Procedure, at each regular session, the Health Assembly shall elect a President and 5 Vice Presidents, who shall hold office until their successors are elected. In advance of the Health Assembly, a white paper has been circulated, which contains names of delegates proposed for consideration, following consultations within their respective regions, as well as their respective countries. To consider the nomination for the office of the President of the 74th World Health Assembly, I recall that in accordance with the practice of regional rotation, which the Assembly has followed for many years, the President of the 74th World Health Assembly should be chosen among delegates of members of the Southeast Asia region. I understand that Mrs. Doshin Wangamo, Minister of Health of Bhutan, is proposed for the office of President of the 74th Health Assembly. Is this proposal acceptable? In the absence of any observations, and as it appears that there are no other proposals, I suggest, in accordance with Rule 80 of the Rules of Procedure, that the Assembly approves the nomination and elects its president by acclamation.
Okay, we can start. Your Excellencies, Honorable Ministers, Ambassadors, Delegates, Director General, I would like to thank this august Assembly for their trust in electing me as the President of the 74th World Health Assembly. I would like to express my appreciation to my predecessor, Her Excellency Ambassador Keva Benz, Permanent Representative of the Bahamas, for her contribution to the last World Health Assembly. We shall now turn to the nomination of the office of the Vice President of the Health Assembly. I would like to recall that since the delegates from the members of the Southeast Asia region has filled the post of the President, it would be equitable to choose the Vice President from among the delegates coming from other 5 WHO regions. In this regard, the following proposals have been received. Professor Benjamin Ongpaktin from Benin, Ms. Mr. Tanil Kek from Estonia, Dr. Amelia Flores from Guatemala, Mr. Ikban Serajiva from Mongolia, Dr. Hanan Al-Kawari from Qatar. Are these proposals acceptable to the Assembly? In absence of any objection, I take it that it is the wish of the Health Assembly to elect by acclamation the 5 delegates mentioned for the post of Vice President of the 74th World Health Assembly. I congratulate the Vice President on their election. I shall now determine by the lot the order in which the Vice President shall be requested to serve should the President be unable to act in between the sessions. Professor Benjamin Hopkins from Benin, Iqbal Serajev from Mongolia, Dr. Hanan Al-Kawari from Qatar, Tanil Ik from Estonia, Dr. Amelia Flores from Guatemala. That's it. Perfect. The names of the 5 vice presidents have been written down on 5 separate. Okay, so that's it. No? The Assembly will now consider the special procedure to regulate and conduct this virtual meeting of the World Health Assembly, which are contained in the Annex 1 of the document A74/45. As we all know, the document before us today has been the subject of extensive informal consultation involving all member states. May I take it that the Health Assembly is content to adopt the special procedure contained in the Annex 1 of the document A74/45 and to apply them to this meeting? I see no objection. It is so decided. Thank you. We shall now turn to the election of the chair of the main committee. For the office of the chair of the Committee A, Dr. Adriana Amarilla, Director General in the Health Promotion, Ministry of Health of Paraguay, has been proposed. Is this proposal acceptable? In absence of any objection, I take it that it is the wish of the Health Assembly to elect Dr. Adriana Amarilla of Paraguay as the chair of Committee A. For the office of chair of Committee B, Dr. Iframi Waganabita, Minister of Health and Medicine Service of Fiji, has been proposed. Is this proposal acceptable? In the absence of any objection, I take it that it is the wish of the Health Assembly to elect Dr. Iframi Waganabita of Fiji as a chair of Committee B. We shall now proceed to the composition of the General Committee in accordance with the Rule 30 of the Rules of Procedure. The General Committee consists of the President, the 5 Vice President, the Chair of the Committee A and B, and 17 delegates to be elected by the Assembly. In order to have an equitable geographical distribution of the General Committee, I propose that the Assembly elect the remaining member of the General Committee as follows: 4 member states from the Africa region, 4 member states from the region of the Americas, 2 member states from the Eastern Mediterranean region, 4 member states from the European region, 1 member state from the Southeast Asia region, 2 member states from the Western Pacific regions. The Secretariat has circulated in advance a white paper containing proposal for the nomination of the 17 other members of the General Committee. I shall repeat these proposals: Algeria, Bermuda, Canada, Chile, China, Cuba, Djibouti, France, Oman, Philippines, Portugal, Russian Federation, Sri Lanka, United Kingdom of Great Britain and Northern Ireland, United States of America, Zambia, and Zimbabwe. Burundi, Algeria, Burundi, Canada, Chile, China, Cuba, Djibouti, France, Oman, Philippines, Portugal, Russian Federation, Sri Lanka, United Kingdom of Great Britain and Northern Ireland, United States of America, Zambia, and Zimbabwe. Does the Assembly agree with these 17 proposals? I see no objection. I take it, therefore, that it is the wish of the Health Assembly to elect these member states as the member of General Committee. It is so decided. Before we complete our business, I would like to address some housekeeping matters. The General Committee will hold its first meeting immediately following the meeting of the members of the committee. Use the link that was sent to them for the General Committee to access the meeting. May I remind you that according to the Rule 30 and 31 of Rules of Procedure, attendance to the General Committee is limited to its member and to not more than 1 member of each delegation to the Health Assembly not represented thereon. The second plenary will resume following the General Committee meeting. I would also like to remind you that the next plenary will reconvene subject to the decision taken in the General Committee with the following program: Presidential Address, Item 1.4, Adoption of the Agenda and Allocation of Item to the Main Committee. Item 2, Report of the Executive Board on its 147 and 148 session and on its special session on COVID response. Item 29.2, Status of Collection of Arrears Distribution, including member states in error in payment of their contribution to an extent that would justify evoking Article 7 of the Constitution. And Item 3, Address by Dr. Tedros, Director General. The meeting is adjourned. That's it.
The World Health Organization is steadfast in our mission to promote health, keep the world safe, and serve the vulnerable. And committed to our three ambitious goals, the triple billion targets laid out in our 13th General Program of Work. Reaching these targets is vital to meet the Sustainable Development Goals by 2030. They are what guides our work across the people can have access to the health services they need without financial hardship. Second, we work so 1 more billion people are better protected from health emergencies. We invest in and guide countries so they are equipped to prepare, prevent, detect, and respond to natural